Hi, I'm Ben Allen. Ben Allen. I'm a GP at Burley Health Centre and clinical director for primary care in Sheffield. We've been having some meetings where we've been talking about with our staff across the city around what are the challenges and what are some of the solutions. And one of the challenges that we were talking about and we had some sessions on was around retention of staff. Really important issue, and we had a bit some big brainstorming sessions around what things, practical things that people could do to help. So this is going to be a few minutes of me just rattling through some of the things that were talked about, some of the ideas, and there's a little bit at the end, particularly around what some of the salaried GPs have been saying around what matters to them in terms of retaining salaried GPs in particular. So, a couple of basic principles were around how some of this stuff seems kind of basic and obvious, but they're not often done. So I think it's just important to not dismiss things that sound simple and actually having the discipline to take those things forward. And I think one of the other things was that so many of these things that would help are crowded out by doing the work. And I think that I think one of the principles here is around what do we really think matters? Is it just doing the work, or is it also thinking about how the work is done or developing the team that does the work? And if we really think those two things matter, then it's possible that it could take priority over some of the time that we have, and that could make a big difference to the actual workload itself. And a really major theme was around, this was interesting for me, was talking about, the subject was around retention, but actually involving staff in decisions. Autonomy and helping people to be involved was a really big theme as well. So here's some of the ideas. So one was around some stuff around leadership, around reducing hierarchy, more listening, more engagement, empowering and trusting staff. Oh, and by the way, in the description in the video, I'll have a link to all these, and there's also lots of links to other kind of websites that might be able to find more resources around it. So we talked about recruitment, so having a welcoming card to new staff, maybe with photos of some of the other staff and the roles that they do. We talked about involving staff in the recruitment. So if it's a reception team, for example, recruiting, then involve them in asking, what is it that you actually want? Helping them to do the advert, putting quotes in from the staff, and also having them involved in the actual recruitment process. And there's a couple of recruitment plans and ideas and things that will be in the links. Having exit interviews for staff who are leaving to try and learn about reasons they're learning and what things you can learn based on that. There was stuff around staff engagement, so it could be that every 3 months people could send a survey monkey asking questions, and again there's various questions that you could be asking, and the important thing there would also be around feeding back to staff what people have said and having clear action plans in how you're going to respond to that. Good news stories were talked about, and spending time connecting with staff, so engaging, listening to their ideas and their struggles, and asking people what's keeping you here or what might make you leave, and then again acting on those things. A very big theme was around meetings and having time to think as a team. So quick operational kind of huddles at the beginning of the day. So that might be the whole team, or it might just be members from each team in the morning, just rattling through what are the pressures today, what do we need to do about it, making sure that everybody knows important things that are going to be happening, and maybe kind of parking some of the more meaty things for other meetings. Talked about scheduling and planning regular meetings. That might be for a whole team, but it also might be for individual teams, to making sure those things happen. It's about the facilitation, so those kind of questions around, rather than using those meetings as kind of just giving out notices, could that be packaged in an email and instead use the time together to be having that discussion, wrestling with problems, coming up with ideas, and having that debate and problem solving together. We talked about the importance of developing trust and psychological safety, where everybody is able to speak up. And how do you do that? So one of the ways would be around having time where you're just learning about each other as people. So you're actually developing empathy for each other. It's also about kind of slightly increasing the level of vulnerability that people might bring into meetings. That might be better done in smaller groups, might be one way, but I might be talking about what challenges people are finding personally, or areas that they want to grow in personally. Yeah, and when you have meetings where people really bring themselves more fully, and they're feeling a sense of trust and safety, then when difficult things kick off, people are more likely to be honest and more likely to be brave. And you need to obviously develop an organisation that will look after people when they do that. Some people talked about having a meeting with no agenda, just allowing staff to bring their own ideas and questions. We talked about having food. It is very cheap in the long run when it comes to building teams. So considering what training could be done as a practice where all the different roles are coming together. There was one example of a meeting where all the different roles were sat in groups, and they could ask. There could be one thing that they ask of all the other groups, and then you go around and people make a request to say, we would really appreciate your team doing this for us and your team doing this for us, and then going around. There was talk around having MDTs around difficult patients or frequent attenders. So how can we, as a practice, manage people in a way that is effective for the patients and for the organisation? Talked about social events, and again, it might be good to ask staff about what kind of things they might benefit from or enjoy doing together. And in Sheffield, we've got the protected learning initiatives, and there was a lot of talk about that, and that is actually protected time. Which is very precious, and we should spend more time kind of getting stuff in the diary, really thinking about how to use that time well, and also putting on sessions for nurses and non-clinical staff so that we fully utilise that time together. There was stuff around HR to do with reviewing study leave and having good pay structures. There was some stuff around having meaningful work, so that might be to do with kind of holistic care, so continuity, using the roles well, having really good triage, having longer appointments. I think it's just around enabling people to feel like the work they're doing is making a difference, and it might be a case of tweaking the way that the work flows in and the time that people have. And we get pretty burnt out with targets and goals that we don't necessarily believe in, or that aren't very motivating. But let's not throw the baby out with the bathwater, and let's think, actually, what are the things that really matter to us? What do we want to be driving towards? And could different teams have goals around, that's what I want to achieve by the end of this year? And that could be quite motivating for staff if it's something that they've chosen and it's meaningful to them. Okay, so what else? Looking at other organisations that are thriving. Someone talked about having just a chart that says how people like to have their tea and coffee. Again, really simple, but enables you to look after people. So the last thing then was around this question. Someone particularly was really struggling with the fact that they were struggling to retain salary GPs, and were having to use a lot more locums than they wanted to. So we put this question on Twitter, and just to ask people who were salaried or locums, what makes the most difference in terms of why you might want to be a salaried doctor or why you might have left. By far the biggest was about continuity. People like having continuity of care, continuity with the patients, and I think that we often think about that from the patient perspective because it's really important for patients, but it seriously is quite a big factor for clinicians as well. So again, investing in reception teams and the time that they've got to try and make sure that we are seeing, building relationships with patients. Another thing was around having a positive team environment. So again, all the stuff that we've talked about in this video so far are things that could develop the team, and that helps you to hold on to those staff, and it's really time well spent. Work intensity obviously is going to be a challenging factor, but that was one reason why people prefer to locum. And a positive was around the stability, in terms of pension, holiday, sick leave. flexibility was a really important thing. So some people would leave because of the lack of flexibility. So again, it's and again, this could be for all staff. You know, it really makes a difference when an organisation's flexible around particular leave and holidays, and finding ways to stretch that for each other as well. Another important perk was around having paid time to develop, be able to go on courses, being appreciated, listened to, involved, and some people liked being a GP trainer. So that's a little whistle stop tour. In the description for the video, I'll leave a link that will have all this written down, and lots of other links that will lead on. So I hope that's a little bit helpful.